All right. Good afternoon and welcome to today's Hearts for Home Care training on leading a legislative meeting. A couple of housekeeping items before we get started. So those joining, you can kind of see a new image over my shoulder. We have kind of given a freshen up on our look. Hope everyone likes it. You have probably seen it on newsletter, and if you go to our social pages over the last few days, it's also being uploaded there. And one other thing that you could find out about what's new at Hearts for Home Care, it's our podcast. So we actually have one releasing on Friday, Home Care, you say. That is going to be released at 8 a.m. Where you could find that is on our Hearts for Home Care page on the top right, and I will show you all, share my screen in a little bit. But you could also find it on Spotify, Apple, and iHeart, and other anywhere else that you could find podcasts are available. Again, free, and it's a way to communicate a little better and hear from legislators, regulators, those in the community interacting, providing, being cared for in the home. We're going to hear from them, get their perspective, and just give a little more awareness to what home care is. As always with these trainings, we like trivia. So during it, instead of to start it, we are going to ask some questions, and first to answer is going to win. The nice new logo. I know I blur myself when I do that, but we're going to give away the nice new logoed merch. And all you have to do is send to advocacy@heartsforhomecare.com your mailing address should you be the winner. I will say who the winners are when I see it in the chat. But with that, let's get going. So, leading a legislative meeting. So in home care, those that we, on our end, our base is always trying to influence legislators to, make it more feasible for our staff to be paid adequately. And what that does is allows more home care clients to receive care. Interacting and engaging with legislators and having meetings is key to this. Now, our first trivia is going to come right out of the gate. So when you're meeting with legislators, there's one thing that is key. It's not like you see certain legislators on TV and you just choose someone that you think you should meet with just because you see them, they're popular, et cetera. They're a federal legislator in Washington, D.C. Whatever you're thinking, there's one way to do this. So whether it be a federal or a state legislator, the individuals you are looking to connect with, here's our first trivia. Who are they? What type of legislator are you specifically looking to connect with? It's blank, blank legislator. My blank, blank legislator. What is that blank, blank for the first trivia win? Give one more second in the chat. It is a state rep or it could be a congressperson, but they are something specific. We'll give it one more second. We'll have more. Dorothea is very close and we'll keep moving. So Dorothea, yes, you are correct. There's a different way to say it. Megan's close too, but Dorothea, we're going to give you the win on the first one. So you could email advocacy@heartsforhomecare.com with your address. So it's direct constituent. So everyone on this call and everyone in general has a state rep and a state senator at a minimum. And on the federal side, all states have 2 senators and a congressperson that represent you. So when picking someone to meet with, the legislators, either state or federal, want to meet with those who vote for them. So they want to meet with their direct constituents in the community. It's not that they don't want to hear from others, but what's most important to them is who they represent. So when you're looking to schedule meetings on your own on behalf of home care, that's always the way to go. And Cindy, great point on your first answer. So we are going to quickly share my screen because some of you may say, if you're watching this live or watching the recording, how how do I know who my legislator is? So we are going to go and share away here. And I am going to take you to our Hearts for Home Care website. And on here, if you go to heartsforhomecare.com, this is our greatest platform for you to find out anything. When you scroll down, as Cindy said, there is a tab, Find Your Lawmakers. When you click that, I am already logged in to my Hearts for Home Care, to the website itself. So what would happen is I would put my name, address, email here and hit continue, and it would populate from the president all the way down to local officials that represent me directly. It wouldn't be anyone else. So now I'm going to go back to our homepage itself, because I had mentioned before the podcast. So I waited till we got here. So this is where you'll be able to find it on the top right. You can see the symbol. And if you just click there, this is where you can find our upcoming episodes, and 8 a.m. Friday, you'll hear our first one. So I'm going to stop sharing, go back. So now you know who your direct constituent legislator is. So next step, when doing this, you have a few ways to go about it, either phone call, or you could look them up on the Find My Legislator and email them. A great way to open it is who you are, what you do in home care, and why you're reaching out to them. Whether it be to advocate for the field staff that are taking care of you, if you are field staff, to advocate on behalf of yourself. If you're part of a large group, a lot of times people will advocate as groups, either with state associations in home care or the Alliance, our national association, where we advocate Medicare side. Like, what that means when you're dealing with federal legislators, it's Medicare, typically home health and hospice advocacy. And when you're dealing with Medicaid and connecting with your legislator, it's typically a state representative or senator when you're setting up these meetings. So again, when you're setting them up and you send the email to whomever it is, a state or a federal, let them know who you are, that you are a direct constituent of theirs, that you would like to get together and discuss whatever it is, lay it out briefly, and say you're advocating on behalf of either yourself or others, and you would like, 10, 15-minute conversation on home care itself, why it is the fiscally responsible option to provide care, and it's where 99.9% of Americans would rather receive care versus institutional care. We always say we are not poo-pooing the need for institutional care at some point, but if you don't need it, we want to make sure that you could receive care in the home as long as possible, and it's more cost effective. All right, so now you've either sent the email invite or you've called and scheduled a meeting. So when you're going to do that, if it is working with someone like Hearts for Home Care, if you see what type of issues that we're advocating for on our website in whatever state you live, or any day now, CMS is going to release their final rule. And what that is, it'll determine if there are cuts to the Medicare program that would affect home health. So depending on what it is that you're getting behind, either, Medicaid rates in a certain state, right now on point with that would be like Pennsylvania, missed out on the most recent budget increase for home care workers that are with agencies. And a lot of you are obviously connected and would like those rates increase, because the better we could pay our clinicians in the field, the more we have, the more hours we could provide care in the home to those that need it. So once you send out that invitation to whoever it may be, if you're working with someone, again, like our group, with other groups, you want to discuss with them what the actual asks are. And then when you know what the asks are, how you can include a story, a personal story about connecting home care to the need for that increase. Everyone has their own personal story in home care, whether it be someone you're taking care of in your home, a family member, or you're an employee and you see a lot of hours that can't be filled, etc. So whatever that is, you'll align yourselves with either the group that you're with, like Hearts for Home Care or associations, etc., or what it is important to you. Then when you do that, don't be afraid to bring, uh, if you're doing it on your own, notes to look at. There's nothing in this 10 to 15 minute meeting you're going to get with the legislator that says you have to have everything memorized. It's better to have it down and organized on either a piece of paper, on a binder, and a legal tablet, so that you're able to really be clear about what your asks are in those short meetings. You really don't get a lot of time. So don't worry, don't stress about reading off them. My colleagues and I, when we go into meetings, we'll have folders when we go in with groups. We're looking at them. It wouldn't be possible to really memorize everything on the sheet. And what you don't want to do when you are getting these meetings is say something that's not true. Because that's the one big no-no. Don't make things up, don't elaborate. We want to be factual. So when you are having these meetings, go off the details that you have that are concrete that you're bringing with you to these individual meetings. Next, once you're gathering all of your thoughts, getting that story together that you're going to connect to the facts that you're bringing to the meeting, do a little, prep of your own. Either the mirror or talk to someone else as if you're doing it, or reach out to me, advocacy@heartsforhomecare.com, and just walk through what your meeting is going to look like. We're going to get a lot of trainings like this over the course of the next 2 months as we get ready to do a lot of advocacy, especially in the States from January to May. So again, I'm available if you email, if you wanted to walk through something to prepare yourself for this. But yes, prep for the meeting. And then when you go, uh, if you're part of a group that does have collateral materials that have like facts and stats on why home care is more cost efficient for legislators to get behind, misshifts that are happening in the industry that you want to point out, but whatever are facts and data that you want to leave, bring those in a folder. If you're going by yourself, you're not part of an agency itself, but you're either a consumer or a loved one, just bring your organized thoughts with you. And then if you are part of an agency itself and you have brochures, etc., on what you offer to that legislator in his or her district, bring them. They love to have that. They like to have resources available. They want to be provided these things so that when others ask them what is in the community, you could, be that resource for the legislator. Hey, I met with someone from XYZ home care company. They left this. So, don't shy away from that. You want to be a resource for them. So now you have your thoughts together. You're ready for this. And we're going to talk a little bit after we go through the steps of just having the meeting. When you do work with groups, a lot of times there are advocacy days or lobby days that you could be a part of where you'll be part of a team. But we're just going to talk about individual at first. And then we'll go back to those points where group meetings become something that you have to line a little better than doing it individually. But so now you have the meeting scheduled. You have all your details together. You have any leave behinds if you're part of an agency. You show up for the meeting, get there a little early. If you're not early, you're late. So try to get there a little early for the meeting with all your stuff. Introduce yourself to whoever it is. The legislative assistants are usually there to welcome you. You get to the meeting itself with the legislator. It's the open. And again, we want to do this briefly because we want to spend the most time talking about your asks, telling your story, and getting to the ask itself. So the open is who you are, where you reside. That's like the trigger for them that, oh, they're my direct constituent if they live there. And then what you do if you are an employee with the home care agency, or what you do in terms of if you're just a family member that cares for someone or you're the recipient receiving home care. So after the open, you're here to talk today about XYZ. Go right to the sheet and whatever you provided and go through the details specifically. And then you're going to tell your story. What is that personal story that connects what you see and what you're involved with in your own life in home care, how that connects to what you're asking them to support, whether it be a rate increase, better conditions, administrative rules that we could lessen to make it easier to provide care in the home. But whatever it is, whatever that story is to connect to your ask is next. Pause for any questions. When you pause and say, are there any questions? This is super, 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 super important. If they ask you a question and you don't know the answer or you're gray, what is the phrase you say to that legislator? Here's our second trivia. If they ask you a question and you don't know the answer or you're gray, what do you do? What do you say to that legislator? Do you make something up? Do you guess? What do you say? There's only one go-to at this. Yes, Cindy. Cindy has acquired a newly minted, there we go, Megan. We'll even go one more. Have acquired new promotional items. So yes, email me so I remember at advocacy@heartsforhomecare.com. Great question. I'll get back to you. Circle back and reach out to them. Never make anything up. My go-to is, great question. I don't know the answer, but I will get you the answer. What this does, two things. One, making something up and it's proved out to be wrong. After one meeting, you immediately lose the trust connection with that legislator. Two, this affords you another opportunity for a touch point with that legislator to either go see them again, reach out to them via email, and get the factual answers that they desire. All right. So we got past that. Now comes the hard part, I guess. I don't see, again, this is what we do for a living, but it's not a hard part, but the ask is the awkward part of these meetings. That I'll give you a little trick that I use and everyone come up with their own. But so after you get the questions out of the way, always ask, do I have your support of whatever it is that you're there to talk about? Legislation to increase rates, if that's it. I put my tongue behind my teeth and just smile like that and let them answer. Don't blink, don't move, don't do anything until they say yes or no. If they say yes, that's great. If they say no, not terrible. Follow up with why. If they give you a why they don't support that, make sure after the meeting, you reach out to me, you reach out to others, maybe if you're working in groups that you can get back to, and let them know that this state representative doesn't support it yet because of X. That gives the people you're working with, myself, that can help you with an answer, follow up and get back to them with that appropriate answer. And now you've started to build a relationship with that legislator. All right, so we're going to pivot here, and I'm going to remind you as we go now to talk about when you're involved in a legislative meeting as a group. If you have questions during this, just put them in the chat. Those of you that are watching the recording of this, at any time, you could always email advocacy@heartsforhomecare.com with any questions you may have. So now when you're with a group, the meeting itself, the flow stays the same, the open, there's multiple people that you're just going to go through, titles, etc. You're going to go through your ask, you're going to go through your story, and then you're going to ask the tough question. Do you support what it is we're here for today? What you do before that meeting, if there's 2 of you, 3 of you, 4 of you, just go through who's going to be driving the bus on what parts of the meeting. Do you want one person to open and introduce everyone? Do you want everyone to say their names? And then Cindy is going to be the one that talks about the actual ask. And maybe Dorothea is going to be the one that tells the personal story connecting it. And then maybe Megan's going to be the one that does the hard ask at the end, but get that all together and organized in the 2 to 3 minutes right before the meeting. Don't worry about, having massive calls over these things, but just get yourselves ready outside the door with just who's taking what. What's the order of the process? During the meeting itself, when you have a group, as I said before about that question you get when you don't know the answer, don't mess it up. Don't say a guess or I think. Here's another part with a group that you don't want to do. When you're with a group and you have an ask and you have a story and you go through all the details, if one of your 2, 3, or 4 people go rogue, this could happen. It doesn't always happen, but say one of your team members starts talking about potholes on their street and how it's affecting them, or how their insurance rates personally are affected by something. These are definite conversations that could be had with legislators. It's not that they're not, but you're there reserving that time to advocate on behalf of home care. So politely just guide that person back into the conversation. If it's Mike that's, going off the rails a little bit. Hey, Mike, God, that's terrible. But maybe we could, at the end of this, schedule another appointment, a video appointment for you with the legislator to talk about that. And this way we could stay on point here and talk about and advocate on behalf of the home care industry. So just do it politely and try to ease back. Now, the second level of that is when the legislator does it. I've been in many meetings where you're discussing home care and something becomes a talking point that day, a hot topic, either on a state or a federal level. And they answer one of your questions with something totally unrelated to home care because they want to get your opinion. If you so choose, answer it very, very briefly or say, I don't have an opinion on that yet, because it's typically something brand new that they're asking you, and say, but I would love to talk about that more at a later date with you after we finish this meeting regarding home care, because I'm very passionate about it. So again, it's not that you're being rude, but they understand that they're trying to pick your brain and they know what's going on. They're not going to be offended as long as you do it in a respectful manner. So now you've had either the individual meeting or the group meeting. If you want feedback, it was you individually, not with a group, reach out to me. I'm always here for the follow-up. We're going to go over everything that happened and what you could do next. If you're part of a team with a state association or a federal association, they're always going to give you either forms or a QR code to provide feedback from all the meetings. These are vital. So these are vital because all of the information that's provided about these meetings are logged on a platform, so that when you're part of a group and you're with, just say, North Carolina State Association, their advocacy day, what you note about a meeting with a specific legislator is logged, so that when one of their team goes to do follow-up later with that legislator, asking them for, rate increase or whatever it is regarding home care, they're able to go into their platform and read those notes so that they're prepared, and they could say, I know you met with Mike from XYZ agency, 2 weeks ago, who was also passionate about what we're talking about today. And you had stated that you don't support it, you do support it. It just helps make those meetings more impactful and elevates it faster. The legislator sees that others are interacting about the same topic, and they're going out of their way to have face-to-face meetings with them. These are all key for you. The housekeeping at the end items, when you're ready to go to the meeting, dress professional. Either, again, this is what I have on is enough. Sweater weather outfit is enough. You could, wear a suit, wear a business if you, prefer when you're in district meetings. If you are a home care employee and you're out in the field and you're in your scrubs from an agency, by all means wear them. You don't have to fly home and change. And no, you're demonstrating that you're taking time out of your day. It's that important to you that you're advocating on behalf of people receiving home care that you're showing up during work and fitting this in because you need to be a voice for them because they don't have one currently. Thank you. So either give them a phone call a day later or send them an email thanking them for meeting with you. And before you leave the office, it's always key to take a picture for two reasons. One, shows you're interested in what just happened, and then you're able to share that on your social media pages. That is key. Tagging the legislator themselves. If you're part of a group, share it with the group, and then they will tag the page themselves of the group you're with. Email that to the legislator, the group photo. They love sharing pictures in either their newsletters, and e-blasts on their website that they are meeting with their constituents. It's very important to them. Side note, if you don't think that they don't like getting pictures taken, one of my local legislators was nicknamed Cheese because he was in every picture possible all the time with everyone. Giant ham, but they called him Cheese because he was always smiling, getting ready to take a picture. But again, not to dismiss it, but yes, they like promoting, and it's good that they're promoting that they're meeting with you in the community. That's what it's all about. Anyone live has any, questions, things I missed that you thought were going to happen, let me know in the chat. If you're watching this recording, which the great majority do, we understand it's in the middle of a day. When we do these live, we try to do it at lunchtime Eastern time to capture the biggest audience. But when you're watching this, if there's any questions that come up, be sure to send them to advocacy@heartsforhomecare.com, and we will be sure to get back to you. And if there's any, one-on-one interaction with myself or colleagues on Hearts for Home Care team, we could always work with you as well to prepare you for these type of meetings. Coming up next month, you're going to hear from two of my colleagues on public affairs and social media, how that you could advocate from the desk or from your home, so to speak, either sharing stories, telling your story, sharing posts that are put out through our social platforms. We have a link that they'll talk about where you can record your story right on the Hearts for Home Care website, and how that is a great use of your advocacy work when you don't have time to actually go out and do these meetings in the community. So with that, if there is nothing, thank you all for joining, and thank you especially to those watching the recording of this that will be going out. And Friday at 8 a.m., if you're a pod person, we will be launching Home Care You Say, Episode 1. With that, everyone have a great day.